from the station that's on your side. This is Channel 7 News Daybreak.
Hey, welcome back into Channel 7 Daybreak. Today is Wellness Wednesday, and we're joined today by Dr. Erica Stokes with Baptist Health, and we're talking about Ovarian Cancer Awareness Month. 22,000 new cases of ovarian cancer will be diagnosed in the United States this year. Dr. Stokes, I know this is an important topic to discuss, and awareness is a huge key. Early detection, you and your fellow colleagues always talk about being crucial in situations like this. So let's go and talk about some of the risk factors for ovarian cancer this morning.
Sure, Chris. So the risk factors differ depending on a woman's reproductive history. So women who have not had a baby after or by age 35 can be at higher risk. A term baby, or those who never have a term baby. Breastfeeding can reduce the risk, so that's another plus for breastfeeding. Age greater than 63, often 50% of the women that we diagnose are older than that age category. So age is a factor. Family history. So those who have a first degree relative with a history of ovarian cancer. So that could be mom, a sister, a daughter, especially if they are younger when diagnosed in their 30s or 40s. That tends to be significant. If a woman has a personal history of breast cancer, that can put her at higher risk. Postmenopausal ladies who are exposed to hormone therapy, that can be a risk factor. And certainly risk factors don't mean that certain treatments are not appropriate for certain people, but these things may increase the risk of ovarian cancer.
Any symptoms that would cause some red flags or get some bells ringing or alarms to come in and see a doctor?
Sure. So what's concerning about ovarian cancer is that in the beginning, symptoms may be vague: bloating, abdominal discomfort, indigestion that's not really explained otherwise. Most of the time, the cancer is caught in later stages. And so you may have pelvic pressure, an urgency to use the restroom frequently, pain with intercourse, or abnormal menstrual bleeding, again, back pain, bloating, indigestion.
And what about treatment options available?
Sure. So treatment options include a combination of surgery, chemotherapy, and radiation therapy. And you would want to speak to your physician or your specialist about the risk, the benefits, and the alternatives of treatment.
And what about how this is checked? How does someone get this looked at a little closer so those symptoms that might not seem that bad but continue and persist do get a thorough look?
Correct. So keep your regular doctor's visits, keep your regular appointments with your gynecologist or your specialist. Do have a thorough exam, including not only a pelvic exam, but also a rectal exam to help better examine the part of the body where we're able to detect ovarian issues on exam. And then there's imaging that specialists may order to take a look further. And then again, just be persistent. If there are some symptoms that are not quite explained, please stay in contact with your physician so that we can help get to the bottom of the problem.
All right, Dr. Stokes, thanks for taking the time out this morning to explain that. And if you would like to talk with your doctor about this, you can contact Baptist Health at the information on your screen. We'll see you next time, Dr. Stokes. Thank you again.
Thank you.